Peace, family, peace. Welcome back to A Place to Conversate. Here with your main man, your host, Jalil. Listen, if you're new to my channel, take this time out to hit that subscribe button, hit that like button, hit that subscribe button, hit that like button, ladies and gentlemen. I want to take time out right now and take a few minutes to talk to the family about an issue that impacts the black community we don't talk much about, specifically as it relates to health. I want to talk about fitness and diet, or the lack thereof, and how it impacts the black community. As you know, a lot of our people, we deal with a lot of underlying medical conditions such as obesity, diabetes, heart disease, high blood pressure, high cholesterol, and issues from smoking. I also want to talk about the socioeconomic impact that factors in as well. So I want to bring your attention to this article right now that talks about the socioeconomic impact that it has on the black community. Two communities, one county, how social determinants impact food security. One grocery store and community of roughly 25,000 people. This town has a poverty rate of 32%. The majority of the population is either black or Latino. The median household income is roughly $33,000 a year, just $7,000 above Florida's federal poverty line. About 50 miles away in the same county, an affluent city bursts with life and luxury. The city of Naples has an average household income of $118,141 with a poverty rate of 8%. Let me read that one more time so that can sink in. About 50 miles away in the same county, an affluent city bursts with life and luxury. The city of Naples has an average household income of $118,141 with a poverty rate of 8%. Social determinants of health are a major reason why people born in one part of Collier County are expected to live 15 years longer than those in other parts of the county, according to life expectancy estimates by the U.S. Census Tract and the National Center for Health Statistics. Examples of social determinants of health include safe housing, transportation, education, income, access to nutritious foods, physical activity opportunities, and language and literacy skills. These social determinants affect a wide range of health, functioning, and quality of life outcomes and risks. In a community like Immokalee, all these factors contribute to health inequity, specifically when it comes to food security. As we know, a lot of our black people who live in lower income communities don't have access to quality health care, quality foods, nor do we have the luxury of, being able to go to a gym. A lot of people are locked into working a lot, so when they get home, they have other responsibilities. They might be dealing with the kids, things of that nature. So, it becomes just that, a luxury to be able to go to the gym. And I just wanted to use this article as an example to show the disparity that happens when communities that are struggling in lower income neighborhoods or communities versus more affluent communities and the luxuries they're afforded. In just a few minutes, we're going to have a fitness and nutrition expert come on and talk to us about this situation, these issues, and give their perspective. Correlation found between poor nutrition and disease for African Americans. Poor eating habits and lack of exercise among African Americans increase their risk of developing cancer, obesity, hypertension, diabetes, and heart disease, according to recent studies by the Public Health Institute and the California Department of Health Services. Healthcare professionals at the Charles R. Drew University of Medicine, a medical school and college in Los Angeles that provides healthcare to underserved populations, believe this trend of poor nutrition in African Americans is a cause for concern. Obesity and heart disease risk in black people. Racial and ethnic minorities experience disproportionately poor health outcomes for almost all chronic diseases, especially heart disease, with obesity being a prominent trigger for these negative health outcomes. Obesity increases morbidity and mortality in the black community, and its related complications are major drivers of rising healthcare costs, diminished health-related quality of life, and a recent decline in U.S. life expectancy, with the greatest effect seen in the black communities. This is why we need to get really serious about how we eat And we also have to be very serious on exercise. So yeah, ladies and gentlemen, we definitely got to pay more attention to our health. Um, Dylan, we know we're still in the midst of a pandemic, even though we're not talking about it much. You know, cases are rising in the community. So if you have underlying health conditions, if you do happen to catch this virus, it's known to exacerbate whatever your medical condition might be. So, we have to pay attention to that. We have to be more mindful of the things we eat, you know. In just a few moments, I'm going to bring in my good brother, my physical, my man Joseph Hall, who's a professional personal trainer and nutrition expert. He's going to give us, his perspective and some things we can do to counteract um, these issues as it pertains to lack of diet and lack of physical fitness in our communities. Family, I got my good brother, my physical in the building. You know what I mean? Professional personal trainer, fitness guru, nutrition expert, Mr. Joseph Hall, man. Yo, thank you for taking the time out and coming on the set, man. I appreciate that.
You already know, big bro. How you doing?
Good, man. I feel that this is a very important topic, man, that affects our people that, we don't talk too much about. So, I think that you were the perfect person for us to, have come on the set and talk about this issue, since it's what you do and what you deal with on a daily basis. Before we jump into it, man, tell the family a little bit about yourself. Where you originally from?
Well, I'm from New Haven. I grew up in the Hill all my life. I'm now been training for 7 years. I have my own gym for about 5. We have 3 locations at 1175 6th Street, New Haven, Connecticut. And, we working, man. So, yeah, I've been doing this for a little minute.
No doubt, man. You're making it happen for real, man.
Sorry, man,
About to crawl from baby steps. Now you take 9 steps, man. Personal trainer, that's what's happening. So listen, we talk behind the scenes a lot about the underlying medical conditions that affect the Black community, such as obesity, heart disease, high blood pressure, high cholesterol, and issues from smoking. In your opinion, what are some of the factors that play a part in these underlying medical conditions in our community?
Lack of resources, lack of people like me not teaching each other how to stay healthy. We got a lot of companies like maybe like the Edge and a lot of stuff like that, but we don't have them small businesses where we got Black entrepreneurs teaching the youth or teaching people how to eat right, how to do things. For certain people, it's just about $1. With us, it's more like we trying to get people to learn how to eat better and change their lives. It's not all about money. And I think it's just lack of resources. Like I said before, to you, you look in the community, you might have a Chinese store, you might have a liquor store, and then you might have maybe a Walgreens that sell nothing but drug medications. And it's just like, okay, something's wrong. The first thing go get a medication and then go do this, go do that. It's not try to eat better or try to do this or go see this person. He deals with health and start training yourself to learn. It's just lack of resources.
No doubt. I was just about to ask you, that led me into my next question, as far as, do you think socioeconomics play a role in this? But you basically answered that. I've sent you some information, but I don't know. I'm going to read it from an article, man. It just talks about the socioeconomic impact that is an example of how that affects our community. Give me 1 second. Let me get this. One grocery store in a community roughly of 25,000 people. This town has a poverty rate of 32%. The majority of the population is either Black or Latino. The median household income is roughly $33,000 a year, just $7,000 above Florida's federal poverty line. Just 50 miles away, in the same county, an affluent city bursts with life and luxury. The city of Naples has an average household income of $118,140 with a poverty rate of 8%. Social determinants of health are a major reason why people born in one part of Collier County are expected to live 15 years longer than those in other parts of the county, according to life expectancy estimates by the U.S. Census Tract and the National Center for Social Statistics. excuse me. Examples of social determinants of health include safe housing, transportation, education, income, access to nutritious foods,
Mm.
physical activity opportunities, and language and literacy skills. These social determinants affect a wide range of health, functioning, and quality of life outcomes and risks. In a community like Immokalee, all these factors contribute to health inequity, specifically when it comes to food security. Food security is dependent on availability, stability, and accessibility of food supplies, many of which are scarce or non-existent in a rural, low-income area like Immokalee.
That's a fact. That's deep because you look at in the hood, you might get a young man and he's eating Chinese, he's going to get a beer, but he's coming up in an environment that's what they do around. That's what they learn. They don't have access to nutritious foods, or he might not even know about nutrition foods. He think he's eating healthy, but he's really not, because that's just the condition they under. You're low poverty. You don't have no resources. Like I said, back to resources. You don't have no one teaching you this stuff. I mean, so you learn it from your parents, and sometimes our parents, they ate bad, so we go on based off, from them. So it's definitely your environment, because if you go to the suburbs, you might go to a grocery store and you see a whole bunch of greens, a whole bunch of this stuff. You go in the hood, you might go to a supermarket, but you still, it doesn't look like, healthy. It's just like, it's just a difference. It's a big difference. You know what I'm saying? It's just the environment you in. You're low income. The food in that area might be extremely high, so you can't afford it. But in the suburbs, their income is different. So they might, it's not high to them because they're wealthy. They have it.
Exactly.
But us, it's like we scraping off every little penny. You know what I mean? So to eat healthy, to spend some $10 on some fruits or whatever, that's a lot to most people.
Absolutely.
We barely could make it. Gas is going up, so it's a big difference of where you're at, where you're located.
Absolutely. I think that is spot on, especially, in neighborhoods, like you said, lower income neighborhoods. You could go to like a Stop and Shop, and although it's a Stop and Shop, due to the location, the quality of food may still be, not quality, low quality, because of the, population that it serves, versus going to Woodbridge or Bethany or something of that nature. You know what I mean? So, that's spot on. And I think that, when it comes to the social economic factor, it plays a major role. From that article as a prime example, just 50 miles away, a total different world. You know what I mean? Poverty levels, 8% versus 50 miles away, the poverty levels, 32%. Like you said, people don't, we know that coming from lower income environments, we don't have access to quality healthcare. We don't have access to quality food, more or less the luxury of being able to afford going to like a gym. You know what I mean? So, that in our people, we working, we living hand to mouth. We have to come home, deal with the kids, all types of, like you said, they're not educated as far as eating well. And right now, dealing with this pandemic, because, we're still in a pandemic. People aren't talking about it. Still in a pandemic. And, a lot of our underlying issues become exacerbated because of this particular virus. You know what I mean?
Definitely. And like, I think the good thing with my company is we make it affordable for people to train, and we teach them about nutrition. And we deal with a lot of people that's in the community, our people. You know what I mean? We deal with all types of people, but majority is our people. You know what I'm saying? And everybody that comes through these doors, they get help. You know what I mean? They learn how to eat better. They lose 50, 60 pounds. You got to understand, to lose 50 or 60 pounds from a person, to lose that type of weight, you're taking away medications. You're putting years on your life. So for us to do something like that is major. You know what I'm saying? Because you go to these you go to these big gyms, you're paying 500. You might see your trainer 3 times out the month, 2 times out the month. Who can afford that?
Wow.
So it's a big difference of the impact that we're doing to the community. So it's like a hidden gem. You know what I'm saying? Literally.
You are providing a serious community service, man. You know what I mean? I watch your work. I see you posting on Instagram. I'm seeing you post before and after results of a lot of your clients, man. And you like major work, man. You know, salute to you. And you know, like I said, man, I couldn't be more proud of you. But listen, I know you're busy. I know that you just got through training, you know. So before you go, I want to just ask you, you know, what are some tips that you could give to someone, you know, a quick tip to help them get started with eating more healthy?
I would start when you go to the grocery store, start trying to focus more on veggies, healthy fats like nuts, even your seasons, Mrs. Dash that has no salt. Start drinking more water instead of the soda. Even if it's you do 2 bottles and one day you do 3 bottles, next day you do 4 bottles. Start taking your vitamins, your supplements, protein. Just try to do it one day at a time, man. I mean, one small change could make a big impact on your life, and you just got to start. You just got to start one day at a time. And I know it's hard because some people need that push. Some people can't do it on their own. But I promise you, if you take it one day at a time, just to change your eating. What's big on me, and I tell my clients, meal prep. Get you containers, get you some chicken, get you some brown rice, get you some veggies, and meal prep for the week, so you don't have to go to McDonald's because you don't have, you're not prepared. You don't have to order Chinese food because the stuff that we eat is basically you are what you eat, man. So if you start eating better, you start feeling better, and the stuff that you put in your body, that's how you can really feel. You know what I mean? If you eating all this processed food, you're gonna feel lazy, you're gonna feel sluggish. But if you start just, drinking more water, eating more veggies and just getting feeling better, you're gonna start, yeah, that's a fact. You're gonna start feeling better. And once you start feeling better, better things happen, better opportunities because you're in a better mind frame. You're more positive. You know what I mean? You're more engaged in life. When it's just like when you're eating all that bull crap, you're always lazy, you always got an attitude, you're always mad. You know what I mean? So it's a big difference. So that's why we gotta get ourselves together, especially the community, man. That's why I love what I do, because we help a lot of people in our community. So
Absolutely.
it's just, one day at a time, man. Just change everything, throw all the stuff away, your bad food, go grocery shopping, get some veggies, get some chicken, get some, and just try to change your eating, man. Because it's 80% how you eat and 20% of everything else, man. So that's one big tip I would say is just try to eat better.
That's incredible, man. That's a great tip. Thank you. So, one last thing. What are some things that people can do at home to get started with exercise if they're not able to, afford a gym right away?
You could go to Amazon, order you some bands. You could look up YouTube videos. You could do calisthenics. You could do push-ups, sit-ups, squats, crunches. Do something. You could time yourself, make your own circuit. Do a minute circuit. Do some crunches, 1 minute. Do some push-ups, 1 minute. Do some squats, 1 minute. Do some, jumping jacks, 1 minute. And do that for like 4 or 5 rounds just to get active. You can do that every day. And I guarantee you, if you do that and you start eating better, you're guaranteed to start, losing the weight, feeling better, getting stronger. But it takes you to put in the work. You can't be lazy. Some people say, oh yeah, I want to do it, but then one day turn into I'll do it tomorrow. Oh, I'll do it Friday, and then Friday turns into 2, 3 years, and then you just gotta do it. Especially if you got kids, if you're gonna do it for yourself, do it for your kids, man. Like, come
Absolutely.
on. Sometimes we get so out of shape that we can't even play with our toddlers. So it's like, do it for your kids, man, because if you do the things that I tell you, you can add years on your life. And
Absolutely.
that's so important, man. And I love what I do. Like, I do this from my heart. I don't even care about the money. It's not about that. It's about changing people's lives, man. And that's what I'm about.
Absolutely, man. Yo, those are great tips, man. And I'm gonna start implementing that. Taking that philosophy for myself because I'm guilty of that too. I'm one of those. Not necessarily making excuses, but yeah, I'll do it, and then I try, fall off a little bit, then try again, fall off. But yeah, most definitely, man. Listen, with
Mm-hmm.
great tips. I thank you so much for coming on the set, man. I
Right,
think
no, man.
it's going to be very helpful to our viewers, man. And I also want to talk to you. We talked before about, you coming back maybe on like a regular basis, just
Definitely.
like once a
Anything
month.
you need, anything that people need. Maybe you get some people they have questions, and I'll come out here and answer them. Anything I could do to help, man. I'll love to help, man. No problem.
Yeah, man. Give us some tips, like some monthly tips or, you know, some stuff that we can eat. Just stick your head in every month and just chime in, come on the set on a regular basis. But we'll talk behind the scenes on that, man. But listen, I love you, man. Thank you again for coming on the set. You know what I mean?
Cool.
Have a good night, man. Salute.
All right, too, bro.
Later, man. Peace.
All right, one.
Hold on and check in, everybody. My fam right there, my people.
Take it easy.
Easy. Once again, I just want to say thank you to my brother Joseph Hall, owner of Hall Fitness, for coming on the set, talking with us about this important topic as it relates to the health in Black people today. But I want your thoughts, family. I want y'all to hit us in the comment section and let us know what you think. Do you agree or disagree that socioeconomics plays a major role in the health of Black people today? And on that note, I'm about to get up out of here. I want everybody to be safe, take care of yourself. Until the next time, see you on the flip side. Peace.